We move on to Chetan for remote training using a simulator. Over to you, Chetan.
Thank you, Ashish. Good afternoon, all. We ended with a good note from Shankar that learning is not a destination but a continuous process. And we all know how important training is, and we all know how COVID impacted this very important aspect of residency training, which is surgical skills. And there were hardly any opportunities for the residents. We imagine whether we can bridge this gap and somehow impart surgical skills to these trainees who were in their residency and who suffered badly because of the lockdown, where they were completely taken away from their ORs and they could not have any hands-on experience on live surgical patients. So can simulation-based training bridge that gap? And we realized that we needed to do something there to bridge this gap and provide training to these residents who were actually sitting in their hostel rooms without any clinical experience. And uh, there is wherein we thought of remote simulation based training, because as you know, in COVID there was travel bans, and we could not meet each other. There were no classrooms, there were no one-on-one interactions. And as they say, invention is necessity is the mother of invention, and therefore we had to think out of the box and invent something which will still help the trainees while they were under lockdown. And there is where remote simulation based training originated. So what actually remote simulation based training means is that the instructor and the trainees are at remote locations. Something like this had never happened before, because surgical skill transfer, as you know, is a very personal thing. You have to be present in person in the OR to train. But with the invent of simulation and with the addition of remote simulation based training, we were able to achieve this during the lockdown due to COVID. So, talking about Help Me Seize Eye surgical simulation based training courses, they are little different from the conventional courses in the sense that they are more structured, and there is always an instructor present to train the trainees. So we offer different courses. So we have a 4-day course on M6 surgery. We have a 1-day course on complications management course. We have suturing course, which is again a 1-day course. And very recently launched, in fact, it is launched here in AIOC for the first time in India. We have the PSTC, which is a phacoemulsification simulation-based training course, which will range anywhere between 4 to 6 days. So we have partnered with very key institutes in India. We are in partnership with LV Prasad, where we have 2 simulators, and we offer all our courses at LV Prasad. We have our very close partners in Arvind Eye Hospitals in Madurai, and we have Dr. Shankar representing Arvind here, and they are one of our key partners, and they have been training a lot of residents on the simulators. We have some of the beneficiaries of simulation-based training sitting in the audience here, and I would like to know from there what their experience was. But these institutes have been helping us with simulation-based training, and we have taken that pain to train specific individuals at these institutes so that they are in position to train others on the simulator, because simulation based training requires trainers. So we have to train the trainers first. They have to understand the machine well, they have to be competent on the simulator. Only then they can impart a training to other residents. uh, Apart from our main center in Mumbai, where we have 8 simulators, we have 2 simulators in Hyderabad at LV Prasad and 2 simulators at Arvind in Madurai. So the instructor training program, as I said, it's a very specific program, and we take the instructors basically we are training the trainers there, and we take them through different phases of training. We make them go through the course as a trainee. We let them observe some trainings, and at the end of it, we ask them to present or train dummy trainees, and this is how they come to know about the different features of the simulators. There are certain nuances of simulation based training that one must master before they can be qualified as instructors. So we qualify instructors depending upon the courses. So with the addition of every new course, we have our director of simulation based simulation development here, Dr. Ashish Bachav, and he spoke about the courses that we keep on adding constantly. So for every additional new course, we have to train the instructors separately, because they need to understand the assignments well, and they should be confident in doing those steps on the simulator before they can actually train residents on those courses. So we all know how badly COVID impacted residency surgical skill transfer. There were less opportunities to train, there was social distancing being done, and there were travel bans. So nothing happened, and I really feel bad for these batch of trainees who could not, have a lot of live surgical experience. But there is where simulation-based training can fill in the gap. So can we really train surgically using simulation, and that too remotely? That is a question that we asked ourselves, and we tried to experiment there, and we invented remote training. So what exactly does it mean? It means that when the trainer and the trainees are at different location, and this training is delivered using internet-based services like Zoom or Microsoft Teams. The level of separation could be different. There was a time when we were at the same center, but the trainer and the instructors were sitting in different rooms because we had to maintain social distancing. It could be in different cities, it could be across continents, and we have very well trained people from Mumbai. We have trained people in France, we have trained people in the US, we have trained people in Madagascar, in Mexico. So this is where a remote simulation based training played a very key role, and we could not have done it without remote training. So how is it different from other forms of remote training? So this is not merely a webinar presentation that we are talking about, because there's actual surgical skill transfer happening there. It involves skill transfers and therefore requires constant monitoring and timely corrections, needs good technological and equipment support, and requires careful observation of the grasp of instruments and the technique that the trainee is performing on the simulator. Equipment support is very key for remote surgical training. We need good internet connectivity, we need good viewing screens, we need good audio visual units, because you need to constantly communicate with the trainees, and we need laptops and things like that. There are specific gadgets that we had to invent to perform this remote training, and it was hand position cameras and headset and microphones. I'll show you a picture. So this is the microscope of the Help Me See eye surgery simulator, and we can see that two features were added to perform remote training, because initially we did not have any microphone in the microscope, and we did not have any camera in the microscope. But then a need was felt to observe the trainees' hand positions and the way they are holding the instrument. And a need was also felt to communicate with them and correct their grasp of the instruments and their movements on the simulator. So we invented these two gadgets in the microscope, and it made our life very easy. We could communicate, we could observe what the trainees are doing, and this is a typical view that an instructor gets to see remotely on his or her laptop. And we can see this on the left is the camera view of the grasp of the instruments and the hand pieces that we have on the simulator, and on the right what we have is the performance of the trainee. So a trainee is being performing a paracentesis here on the left side, and very clear instructions can be given to the trainees, which can help them improve their skills. So we train people in China, we train people in Madagascar, India, US, France, and it consisted of both instructor training as well as resident training. So this is a typical scenario. This is a training room at BJ Medical College, and we can see there is a large screen, and a classroom was being presented from Mumbai to BJ Medical College. There are 4 residents who are sitting next to their simulators, and after the classrooms they would begin their simulator practice, and the instructor would continue to observe their performance on the simulators using the microphone and the cameras that we have in the microscope. So this is a typical setup, and we could fuse both the views from the two simulators on single screen, and therefore one instructor could monitor anywhere between 2 to 4 trainees and 2 to 4 simulator views. So this can be done in a multi-centric way. We have sometimes residents. Dr. Kima is our lead instructor at Mumbai, and she sometimes monitor trainings at multiple centers. She monitors training sometimes at Jepromed and Mumbai continued, and that is how remote training increases the productivity. So one instructor can be present at 2 locations and provide training to two big locations with a big with to the big group of anywhere between 6 to 8 trainees. That's a huge achievement that we were able to do due to remote surgical training. It obviously has its own challenges. We need good technical support. The cost is high because there's a requirement of good gadgets in the form of screens and microphones and cameras. There could be language barrier, especially when you're training across continents. There could be internet issues, and there could be difference in the accent of people, and there could be difference of time zones, and the connect, although it is very good, it is still limited because we are not physically present, and we cannot have the kind of interaction that one would have in presence. So the results of remote surgical based training was that it can be achieved remotely. The skill imparted are equivalent to in-person training, which was a huge discovery. And even after COVID ended, we have continued to deliver remote training because we feel that it is equally effective, and it is equally beneficial, and it is a good use of our resources. Good technological support is of paramount importance for remote training, and we need to have good set of gadgets to conduct this training. The summary is that remote training is a remarkable example of how obstacles can be overcome and surgical training achieved remotely with the help of simulators and simulation-based training. And I would like to end with the note that there was no parallel example of surgical skill transfer done remotely across the globe. So this was one of its kind training done using the gadgets that we have currently, and it was as equally effective as in-person training. Thank you all for your patient listening. Thank you.
Uh, Thank you, Dr. Chetan, for taking us through something which is very difficult to achieve, especially remote training on surgical simulators, and that experience will help us going forward to train multiple people at multiple location with the same instructor. So that's a paradigm shift again. I would say a game changer in remote surgical training for cataract surgery. Dr. Shankar, you have a question?
Thank you.
So, are you proposing any studies to see the efficacy of this remote training with any of your
Definitely,
partners?
that's a good idea, and in fact, we have a large pool of residents
So
now.
this is a way of me also getting you to answer a study with us.
Yes, you're always welcome. You are very esteemed partners of ours, and definitely would like to have these kind of
So
studies conducted.
we will work it out then.
Definitely, Shankar. Thank you.
Thank you, Chetan. Thank you, Shankar. Yes, sir.
I mean, all we need there is a simulator, and we can train remotely. So yes,
All I
I
can
mean,
say is, Chetan,
yeah,
that we are talking to somebody in Bangalore.
exactly.
Maybe uh, it will take some time. Yeah.
Sir, but
Definitely.
in the meantime, we have a workshop in Madurai also for 1.5 days workshop. If you want to refer any of your residents, you can always refer. 1.5 days. It will give you entire experience of the entire. We had an workshop last in January this year. Around 30 people attended from hands-on on the simulator for 45 minutes, and it will give you the entire spectrum and feel of it, and then you can come down for a 1 week program also. The workshop is for free. The registration is very less. It doesn't cost much. I'll get you the details and we will share it with you, sir.
Thank you, Chetan. Thank you,